Good afternoon, everybody. Happy Saturday. I hope you're having a nice weekend. It's a very beautiful day outside, so I hope you have an opportunity to go for a walk or spend some time outside, get some sun. It's a beautiful day. I want to thank you for taking a few minutes to spend with us this Saturday. It's really important that you stay informed. I would say it's always been important to stay informed through this, but now things are going to really start to change as we look forward to opening the economy, new regulations. So I hope you can find some time to tune into this to get the information you need to keep yourselves up to date and safe. We're going to continue every day at 1 o'clock. However, on Monday, it has to be moved to 3 o'clock. There's a governor's call with the White House at 1 o'clock, which is important that I be on. So we're going to have our press conference at 3 o'clock Monday, and then every other day, 1 o'clock. I'll begin, as I always do, by having you take a look at the data. The data should now be on your screen. You can see that we have 327 new cases to report today, and very sadly, another 17 deaths. Just want to take a minute to recognize the toll that this is taking on all of us in Rhode Island, and a special expression of our sympathy to those who have lost loved ones, especially since it's a hard time to grieve and gather as you might after the death of a loved one. As you can also see, our efforts have been keeping hospitalization steady, not down, but steady, and we continue to see a plateau. So that's good news. That's all good news. We have not started a decline. We still are losing people every day to this virus, and so we are not out of the woods yet. And I just want to remind everybody that the stay-at-home order is very much still in effect. I'll be very honest with you, I'm pretty worried about this weekend. I'm worried about the weekend because it's a beautiful day. And even today, I've just heard from friends saying, oh, it's a beautiful day. I have a few of my friends coming over. It's not the right thing to do. And I'm asking you to not give in to that temptation. We're not there yet. The stay-at-home order is not lifted. It may not be lifted on May 8th if everybody rushes out today and hangs out with their friends or has people over, congregates in the park. I'm asking you not to do it. I know patience is wearing thin. I know it's a beautiful day. We're sick of being in our houses. I hear it every day from my own family, and I hate the fact that I have to be imposing a stay-at-home order. But I also see that my fellow governors in Massachusetts, Connecticut, New Jersey, New York have all extended the stay-at-home order. And I would hope to not have to do that past May 9th. So we've all sacrificed so much, and as a result, you see the good data. We're plateauing. It looks pretty good. Hang in there with me. I'm asking you, hang in there one more week. Stay in the house. Hang out in your backyard or hang out, go for a walk around the block. But please do not congregate. Don't invite your friends over for dinner. Don't try to have a cookout. Don't go to the store and crowd in the garden center. Just continue to obey the law, which is a stay-at-home order. If you do that and sacrifice just a bit longer, it is my hope and intention to be able to lift the stay-at-home order essentially a week from today. I wanted to spend some time this afternoon, talking about modeling. A few of you have been asking, what does the model show? Where are we now? Where do you think we are? And so I wanted to spend a few minutes giving you a flavor for where we've been, what we know, where we think we are now. As I have said in the past, we have a team of economists, epidemiologists, and data scientists from Brown University and the Brown's Policy Lab who are advising us. We have our own experts, epidemiologists, data scientists, physicians, infectious disease doctors at the Department of Health, and we've been in close contact with the public health team and data scientists at Johns Hopkins. So we are trying to be as smart as possible to continually update our model based on our best estimates at the time. I will say that this is a new virus. We are learning about it every day, and none of these models is perfect. As you know, I've been reluctant to release models on a regular basis because we can't put too much faith in them because they change. They're highly sensitive to assumptions, and they change every day as factors change. Having said that, they're necessary and they guide our work, and so I want to continue to share a little bit about them. There are really two goals for modeling. First, models can help us understand how bad things can be, and that's essential because the whole way through we have been working for the best but planning for the worst. And we saw in other countries, other states, the worst happened and they weren't ready and a lot of people got hurt. It happened too quickly. So we have been doing our modeling, so we have a sense of how bad could this be so that we'd be prepared for that and minimize the loss of life and sickness in those worst case scenarios. Several weeks ago, when we weren't sure how effective our social distancing would be, our models showed some pretty scary scenarios. You know, we put in place, I put in place social distancing rules and requirements. I hoped they'd be effective. I hoped there'd be broad compliance, but we weren't sure. And so at that time, a month or so ago, we were looking at models which showed really devastating numbers of hospitalizations and deaths. Having said that, thank God that didn't happen. You guys, you made that not happen. You stayed in your houses, you've been wearing your masks, you've been keeping appropriate social distance, and it has worked. Thankfully, it has worked. So as a result, we've dramatically changed our trajectory, and the worst case scenarios that we had planned for haven't happened. So that brings me to our second use of models. And we use them to try to figure out where we might be right now. And so I'd like to, maybe you could put up on the screen the first slide, slide 1. And I want to share with you today where we think we probably are. As you can see from the slide that's on the screen, when the virus first hit Rhode Island, our hospitalizations were growing very quickly. We were seeing a doubling in the number of hospitalizations every few days. That was a scary time because if you extrapolated and said that our hospitalizations were going to continue to double every few days, that would have put us at a place of overwhelming our hospital system and their equipment and their ventilators very quickly. So that's why we had to really clamp down at that time, and that's when we started closing schools, closing businesses, et cetera. You will see that from the beginning, the trajectory has changed meaningfully twice. The first big change was right around April 2nd. You see the exponential hospitalization growth start to flatten and be a bit more linear. That is almost exactly 2 weeks after I announced our first business closures, 2 weeks after I shut down restaurants and bars. The hospitalizations continued to increase, but at a much more gradual rate. But still, I think at that point they were doubling like every 4 days, which was still a terrible trajectory to be on and would have quickly led us to a place of overwhelming our hospitals. You then see around April 14th, the trajectory made another dramatic shift from a more linear growth to what's essentially a plateau. Again, that's easy to explain why. Now that we have the benefit of looking back at it. April 14th was almost exactly 2 weeks after I issued the stay-at-home order. So we know now that the virus runs its course in about 2 weeks. So what measures take place, today will be, you'll see it in the data in about 2 weeks. So it's crystal clear that those two inflection points, closing restaurants and bars and the stay-at-home order, meaningfully affected our trajectory and have led us to a place today, which is a much, much, much better, safer, healthier place than we would have been if we hadn't taken those actions. And quite frankly, if you all didn't do the right thing and stay in your house. I do want to take a second to point out a couple of dots that I hope you can see on the slide. There are a few dots that are highest above the green line right around April 20th to 22nd. There are a few dots above the line. Those dots are, we believe, the result of people choosing to congregate together over the weekends of Passover and Easter. So you see those dots, they're above the line, not in a good way, not what we want to see. And they are at approximately 2 weeks after when we think people were getting together for Easter and Passover, probably family and friends gatherings. So those are people who weren't listening or doing what they were supposed to do. They thought it was okay to congregate. Oh, nobody will know. We'll just get together. It's only 10 people in my family. And as a direct result, we saw an increase in hospitalizations. So that is my way of saying, if in 2 weeks from today we see a spike that leads to people getting sicker, it's because we went out this weekend, on a beautiful weekend, and got together when we really shouldn't. The last model we shared, I think the last time I provided modeling, was right at the time of that last trajectory change, the 2 weeks after the stay-at-home order. And as you can see, had we continued on that blue line trajectory, the numbers obviously would have looked a lot worse. Within the next few days after releasing the model last time, we saw the trajectory change and the numbers leveled off, and now we're in a much better position. A couple more points. A plateau isn't a perfectly straight line. We're always going to see some blips in the line. It won't be a perfect straight line. But we're in the business of looking at a trend. The average over several days. What does the trend line look like? By the way, we're also in daily contact with our hospitals. What's going on? Are you handling it? Do you see the plateau? Do you feel comfortable? And so as you can see, the trend line is generally flat. So the next question you may be asking yourself is, what's the modeling look like going forward? Where are we going to be going forward? So before I ask David to put up the next slide, I want to give a bit of a caveat, which is we don't really know with precision where we are going to be. The modeling team has put together our best estimate as of now as to where we think we will be. But as we've seen in other states that are past their peak, the virus doesn't necessarily follow the course that they had predicted. We all of us in every state are still learning about the virus. So we'll go ahead and put up slide 2. The blue line on this slide models the trend that we just talked about. And what started as exponential growth mostly leveled off around April 21st. Based on the literature and the experience of other states and other countries, we expect there are probably 2 directions that we can go from here. The first direction is the green line, which is a sustained, though gradually decreasing plateau. While eventually we would still see a decline, it's also possible our experience could be similar to that of Massachusetts, where the plateau has lasted for a couple of weeks. So Massachusetts and Boston, they're ahead of us in this. They hit their peak before we did, and they're a couple weeks ahead of us. And their plateau has lasted for a couple of weeks. Second possibility is the purple line, which represents a more traditional bell curve, something you probably have seen, in the news a lot of, a more traditional bell curve, and that is the more traditional curve with infectious disease. You see it go up, a bit of a plateau, and coming down. The truth is, we're not exactly sure if we will have a sustained plateau with an eventual decline or more of a traditional bell curve. What we do know is that it's likely to be one of these two courses, and it's not likely to start moving upward again. That said, you'll notice this projection only goes for the next 2 weeks. That's because the next 2 weeks are based upon what we're doing right now. And I feel confident that the people of Rhode Island have been amazing. And now, in the week that's just happened, people have been obeying the stay-at-home order. People have been wearing their masks when they go to the grocery store. People have been doing social distancing. Our retailers have been amazing. Restaurants have been cooperative. So I have confidence that 2 weeks from now, we're not going to see a spike because folks are doing what they're supposed to do now. Having said that, the question you probably are asking is, okay, so what's going to happen when we start to reopen the economy? And the answer is, we will see as we get there. I'm going to have a lot more to say about that in this coming week or next week, but it's why I'm taking such a gradual approach to reopening the economy. It's why when we start to reopen the economy, we cannot flick the switch. We have to turn the dial and have phase 1 and phase 2, because we'll try it for a week or two and see what the trend looks like and make sure we don't see a rapid spike. And once we feel safe, then we could continue to reopen. So I hope that's somewhat helpful. As I say, this is highly imperfect. Also, remember, the modeling is just one piece of the puzzle. As we decide when it's safe to reopen our economy, when it's safe to go back out for restaurants, when it's safe to open parks, this is one piece of the puzzle. There are other pieces of the puzzle. How is our testing? What's our hospital situation look like? Make sure no hospitals are overwhelmed. Do we have a 30-day supply of PPE? Can everyone get tested within 24 hours? Can everyone in a vulnerable community get tested? Is our contact tracing where it needs to be? So we're trying to move the whole system to a place of safety, knowing that we're going to be living with the virus for a year, and we're going to have to work through it. We're going to go back to work. We're going to go back to school. We're going to go back to the beach, and the virus is still going to be with us. But because we've made all these changes, we've modified our behavior, we're going to be able to do it confidently and safely. The last, I just want to make 2 notes for people who are struggling to pay the bills, which is many, many, many people right now, and I can't emphasize that enough. I'm so deeply aware of how much people are struggling, and I want you to keep reaching out to me, because the more we know about exactly what you're going through, the more I will do my very best to support you every day, just to try to get through the day, get through the week, get through the month. As I've said so many times, the crisis is hitting those hardest who can least afford it. Folks who went into this that were making low wages or were in debt or housing insecure, they are really struggling. They were barely getting by on a good day, and now they're really struggling. And we know that so many people are frankly struggling to pay the rent right now. Last week I said I'd be back with more information about a new rental assistance program, and so I'm very proud to announce today that we have put together a $1.5 million initiative to provide emergency rental assistance, which is available to low-income renters who have been impacted by the COVID-19 emergency and for people who are at risk of homelessness. So those who can qualify can receive a grant of up to $5,000 to support past due rental payments and other fees. So I want to be clear, this is not money to help you make, next month's rent. This is if you're behind and are facing potential eviction. Reminder, you can't be evicted because until May 17th, the courts are closed. But if you're really behind in your rent, this is $1.5 million, a grant of up to $5,000 to support past due rent payments. It's available now, starting today. You can go to Housing Help RI to view the requirements and apply. If you don't have access to the internet, but you're hearing me say this and this applies to you, I want you to call 211, the United Ways helpline, 211, and ask about the new rental assistance program that the governor just talked about. It's called Housing Help RI. I need to thank Commerce Secretary Pryor and his team and the folks at Rhode Island Housing. They have worked with HUD to make this money available. Thank you for your creativity and the way you move so quickly. So that money is available now, and if you need it, I'd encourage you to apply. Finally, I also want to remind everyone that we have more than 20 financial institutions that have agreed to sign a pledge to provide relief to residential borrowers. All of the participating institutions are listed on the DBR website, dbr.ri.gov. As a reminder, these banks and credit unions and lenders are offering a 90-day grace period for all residential mortgage payments for individuals impacted by the coronavirus, with the opportunity to request even additional relief. They've also agreed to not report late payments to credit reporting agencies for residential borrowers who take advantage of the grace period, and they've agreed to a 60-day moratorium on initiating residential foreclosures and evictions, and an agreement to waive mortgage-related late fees. I cannot thank you enough. To those 20 institutions, and your names are all listed on the DBR website, you're doing the right thing for the right reasons in the middle of a crisis, and you are saving so many Rhode Islanders from financial ruin, and I want to thank you for doing that. With that, I will turn it over to Dr. Nicole and then come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you, as always, for tuning in. I want to say a huge thank you to the whole team that has been working very hard behind the scenes to help develop the kinds of models and projections that the governor presented. This response has benefited from an enormous amount of collaboration between the experts we have in state government and the incredibly talented partners that the governor referenced. We want to say thank you to all of you. Partnerships and collaboration are the foundation of our response. That means partnerships with academics, healthcare providers, educators, first responders, public health professionals, business owners, and so many other people. Coming together like this to keep Rhode Island on the forefront of this response is what has been critical. We know that these partnerships and collaboration with the general public are also the foundation of this response. The visuals that the governor spoke about will be on the Rhode Island Department of Health's COVID-19 data page, and it will be available for everyone to reference. A key component to reiterate, to echo what the governor has said, is that our actions absolutely make a difference. They can make a difference for the better if we choose the right actions, like following the stay-at-home order. When we follow social distancing guidance, when we wear our cloth face coverings, when we stay at home, when we're sick, each of us is helping Rhode Island as a whole follow the trend line that we as a state want to be able to follow. When we don't follow the guidance, we're not going to see the kinds of declines that we all want to see to reopen the economy. But we know that it is possible for everyone to hunker down together, being able to see the models, see the impact of your work is a critical motivator. As the governor has shared, in our data, there is usually that almost approximately 2-week lag. This is because the time between when someone is exposed, then develops symptoms, and then engages the healthcare system or gets tested, determines how the amount of time that it takes for our changes with social distancing to be reflected in the model. Despite that time frame, though, our numbers do display the very real-world implications of our decisions. What you are doing following the stay-at-home orders matters for all of Rhode Island. And we need to use that information to be thoughtful and to be responsible each and every day. Right now, it's a beautiful day today, for example, tomorrow, through the week, and going forward. We all need to continue to support each other in making the right decisions. If you're going to be outside, if you're going to run an errand that's a necessary item and then return home, make sure that you keep your distance from other people. Make sure that you're wearing your cloth face covering. Make sure that you're washing your hands regularly. And, of course, we all know and need to continue to say, if you don't feel well, you should not be going out. That is critical. So let's move into the data for today. We have 327 new cases, continuing to ramp up our expanded testing system and seeing the results of that in the number of new cases. And then sadly, we have 17 new COVID-19 associated fatalities to report. Our deepest condolences are with the families of those we have lost. That's important. These people range in age from their 40s to their 90s. There's one person in their 40s, one person in their 50s, 2 in their 60s, 5 people in their 70s, 4 people in their 80s, and 4 were in their 90s. Before turning over for questions, I want to make one last point. A few weeks ago, I made an announcement about steps we have been taking to allow for emergency licensure for nursing assistants, nurses, medical technicians, and other health professionals. This was intended to get critical workforce support into nursing homes and other congregate living settings. We are so appreciative of the people who took advantage of that opportunity and who are now positioned to step up and help. We want to let these people know that we as a whole are making sure in our partnership with congregate living settings that when you show up to help, it's going to be into an environment that we are working as a team to ensure has the infection control measures and the personal protective equipment needed to keep the staff and residents safe. We very much appreciate our partnerships with the National Guard, with other partners, with healthcare professionals, Rhode Island Responds, across state government, all of whom have come together to help stabilize and make sure that our congregate living settings have what they need to keep their staff safe and their residents. So we, as the Rhode Island Department of Health and our partners, will be continuing to reach out to the people who were able to take advantage of these emergency licensure opportunities. And we want to encourage you, if you have done that, a couple of hundred have. We want many more to take advantage of it so that you can stand ready, know that we've done what's needed to help make sure that it's a safe environment. We need you. Continue to engage with us so that we can get you into the nursing facilities, the congregate living settings, that residents will benefit from your presence in making a difference through this response. So with that, we are going to get started with questions. Thank you.
First question is for you, Doctor. From Michael Bilo of Motif Magazine. He notes that the New York Times is comparing current reports to historical averages, finding excess deaths in some states. For example, Massachusetts 20%, New York 42%, New Jersey 72%, suggesting both undercounts of COVID-19 deaths and increased deaths from treatable conditions. What has Rhode Island done to estimate this? What was learned?
So I'll want to provide some additional information as a follow-up once we touch base with our data team to be able to say the specific assessments in terms of what our estimates have been and what's been learned. But the high-level understanding is that deaths have unfortunately occurred in some of the states mentioned where they may not have been acknowledged as being COVID-19 associated. And so that's how there can be a concern for undercounting. I will say that we do have a very comprehensive approach here in the state. We very much benefit from the fact that we have one office of the state medical examiners and close relationship with those who are involved in capturing people who have unfortunately passed away. Our first responders are very engaged. We coordinate very closely with our funeral homes. So we do have a process in place statewide to help determine if there was an unfortunate death, can we, either just prior to or after the death, account for the fact that COVID-19 may have been associated. So while we may have some counts of excess deaths, I would say overall as a state for Rhode Island, we have a system in place that allows us to the best of our ability to capture all of the deaths that have occurred without knowledge of COVID-19 associated with it prior to, but to be able to identify COVID-19 as being associated if it is. We are able to test for that and determine.
Thank you. Governor Scott Barrett of the Newport Daily News says, you mentioned during your briefing Thursday about trying to give students a normal college experience in the fall. Generally, that would include things like attending football games and other events outside of the classroom. Under the best and worst case scenarios, what can students expect to see come September?
It's a great question, Scott, and the answer is we're still trying to figure that out. Earlier this week, my administration reached out to all of the colleges, public and private, in Rhode Island, and asked them to create plans to safely reopen in the fall. And I believe we gave them until the first or second week of June in order to submit those plans back to us. We detailed, in some detail, what a complete plan would have to entail as it relates to social distancing, testing, plans to deal with international students, sporting events, events outside of the classroom, infection control, clean, how they plan to clean, cafeteria. Bottom line is it's a really complicated exercise. I will have a much better answer for you in mid to late June. There's a lot of work for them to do to figure it out. Also, we're going to learn a lot. We will learn a lot together in the next 2 months. So as we get to the place of going back to work, going out for dinner, going to the beach, we're going to learn about the virus, and all that is going to inform what they're able to do in the fall. So it's premature to say, but we're on it, and we're working hard on it every day.
Dr. Alexander Scott, Tanya Signori of the RI Echo is asking you to define herd immunity. Do you think eventually we will be able to attain herd immunity here in Rhode Island?
Thank you for that question, Tanya. Herd immunity refers to a large enough proportion of the population having antibodies or immunity against a particular disease that protects enough of everyone else who may not have that protection. Usually the percentage is over 60, 70% of the population. If enough people have been vaccinated against measles, the higher the number, the better, for example, the more protected everyone is as a whole, because you're less likely to have scenarios where someone has measles and spreads it to someone else because everyone is vaccinated against it. We are still learning whether or not we will be able to attain herd immunity here in Rhode Island related to COVID-19 specifically. There's a lot of information still being assessed so that we can learn about antibodies, what the tests can tell, what actually happens in our bodies. And I want to again thank the Rhode Island COVID-19 Testing and Validation Task Force, because they're working on helping us understand specifically those types of answers. What will happen to immunity for COVID-19? Does it exist? We're still understanding that. And will tests even be able to help us gain that information? So we have a ways to go, but we do know the vaccines that are out there that we have. It allows me to say, make sure that your vaccines are up to date, flu, and so many of the others, because that herd immunity is valuable for helping to protect Rhode Island as a whole.
Doctor, this next question is also for you from Tony Mendez of Poder 102. What cleaning products that are readily available can you recommend to families that have many members living in their house or apartment to stay safe?
Thank you, Tony. The Centers for Disease Control and Prevention, CDC website, has a variety of recommendations for keeping settings clean. In public settings where there are surfaces that are touched frequently by members of the public, as well as in the home. On a whole, particularly in your home, using the normal supplies that you have to keep things clean, and really thinking about the doorknobs in the house, the bathroom sinks, the kitchen counters, things that multiple people in the house may touch frequently, particularly after coming in from work or coming in from outside, are key approaches that family members can use. We want to keep it as practical as possible, and being able to clean those surfaces once a day at minimum in your home is a great approach at helping to keep everyone safe, in addition to washing your hands and many of the other elements that we discuss.
Thank you. Governor Alan Gabberty of WBOB is asking, after May 9th, what factors would constitute the spike that would force you to tighten restrictions on Rhode Island again, and how long would that spike have to last?
Thank you, Alan. We are working on, that's a piece of work that needs to be completed before I would lift the stay-at-home order, and I'm hoping to be able to make announcements around exactly that towards the end of next week. So we know we'll see some increased cases. We hope and plan that it's not going to be a spike, as you say, because we've gotten used to dealing with this. You know, now we are wearing masks, we are staying home when we're sick, we are staying 6 feet apart. We are not going to just flick the switch and open all parts of our economy. But later next week, I'm going to go into some detail around what we might expect to see, and that is a safe level of increase, and then what fact patterns might get us more nervous, which would require me to have to rein back in, as you say, tighten some restrictions.
Brian Amaral of the Providence Journal, very similar, saying, are you worried that if you have to put restrictions back in place after they're lifted, compliance will be more difficult the second time around?
I certainly think about that, Brian. You know, again, this is unprecedented. No governor has ever had to do this before. No group of Rhode Islanders has ever had to live through anything like this, quite like this before. So, you know, no, I'm not worried. If it happens, we'll deal with it. You know, that's what we've done from day one. We look at the conditions on the ground and we make a plan to deal with it. Rhode Islanders have gotten very good at this. We've all become a lot smarter. You know, we're learning, every one of us is learning every day about the virus, how to keep ourselves safe, what we can do to keep ourselves safe. We've also seen, like, those images of Milan, Italy, or New York City, or other places that have lived through some of the horrible days of this were very real, and we don't want to see that here. So, my faith is in the people of Rhode Island to do the right thing at every stage.
Will nail salons be treated the same as hair salons? This is from Paul Parker of the Providence Journal.
I would say yes and no. So the whole category of what we're going to call close in contact businesses will be reopened in the same phase. Nail salons, hair salons, barber shops, all kinds of, beauty salons. Those are all going to be regulated as close in contact businesses. So yes, nail salons and hair salons will be the same. However, there are going to be very specific cleaning protocols, probably reservation systems, and it might be that there may be some slight differences between a nail salon and a barber shop and something else, and a tattoo parlor. But they're all going to be open at the same phase. Possible differences in some of the cleaning and regulations.
John Howell of the Warwick Beacon asks, are protocols being developed for the reopening of libraries, given that they serve as an important resource to so many different sectors of the community? Families with preschool children, the elderly, people without computers, support groups, and even the homeless.
Yeah, great question, and the answer is yes. By the way, these questions you're asking, this is what we're doing all day, all night, every day right now. The process of reopening our economy in phases under all new regulations is it's a heavy lift. We're going through setting by setting, libraries, nail salons, restaurants, public transportation, retail operations, dentist offices, office buildings, on and on and on, and saying, okay, what does that setting have to look like in terms of social distancing, maybe temperature taking, number of people per square feet, cloth masks required, in order for it to be safe. However, you are correct, libraries are essential for so many people, and we're going to figure out a way to open them safely. Same thing, public libraries, public buses, people need to rely on these services, and so we're going to make sure they can.
From ABC 6 News, Nick Papadilla asks, Governor Raimondo, are you able to elaborate yet more as to what going out to eat and going to the beach may look like for Rhode Islanders as we set to reopen the economy and continue to battle this virus?
So I will offer you some guidance as long as you understand that it is guidance subject to change because we are still working on it. But going out to eat might look like many fewer people in the restaurant at any given time, because again, we all have to stay 6 feet apart. It might look like no menus. It might look like folks still have a mask on some of the time, part of the time. Going to the beach might be, there'll be many fewer people who can go in the parking lot at any given time. We might have a reservation system. You might have to reserve a few hours at the beach. There might have to be like porta potties instead of fully opening the bathroom facilities. So these are all, I'm just trying to give you a flavor for the kinds of things we're thinking about, but I will have a lot more to say about that the week after next.
Lynn Arditi is asking, Governor Raimondo, despite aggressive testing, Rhode Island's nursing homes and long-term care facilities account for more than 70% of COVID-19 related deaths in the state, higher than any other state in New England. Why is that, and how is the state addressing it?
Yeah, so I will answer that, and then I want to give the doctor a chance to answer that. Why is that? You can look at that in one of two ways. The good news is we've had a good experience with mortalities and hospitalizations in non-communal settings. The experience all over the world is that the highest risk scenarios are communal living scenarios, and then on top of that, communal living scenarios where you have people that are frail and that are old. So, you have to take that into account. I think what I can tell you, what are we doing to address it? I mean, if you look at what's happening in our veterans home and compare that to other states, we are doing meaningfully better. And I don't in any way want to minimize what's happening, which is why I'm choosing my words very carefully. One death is a terrible thing. One person getting sick is a terrible thing. But what are we doing is, we are on it right away in that veterans home with extra PPE, extra testing. Within 3 days, we tested every resident and every staff member. We quarantined the people immediately. We had ingress and egress specific doors to people who treated the COVID patients. We are really ramping up our efforts for mobile testing of people in nursing homes. We have set up a National Guard special support team targeting and going into nursing homes that need extra help. We're setting up specific COVID positive nursing homes. We're providing extra PPE for residents of nursing homes. We're providing wage supports for the lowest wage workers in nursing homes. So we're doing everything we know how to do. We're getting better and stronger at it every day. And unfortunately, just a really terrible and sad reality of this virus is that it's hardest to control in communal living and sadly has the worst impacts on the frail, the compromised, and the old. You want to add anything?
The governor really answered fully in a very tough scenario that we have and every other state has. And we'll again reiterate that Rhode Island has the highest population of people who are older than 85. And even just hearing today, I mentioned 5 people in their 80s, 5 people in their 70s, 4 people in their 80s, 4 people in their 90s. Not every state has such a robust and long-living population that we have in Rhode Island. And this is our topmost priority, being able to address the fact that we have a precious older population and a virus that transmits very easily when people are close together and are vulnerable because of being medically fragile or physically fragile. So it's an unfortunate scenario, but as the governor has mentioned, we have all hands on deck to do everything we can in our state, given that population data point that I shared, to control this and address it.
Our last question for the Saturday briefing is from Nancy Thomas of RI News Today. Can you give us a total of deaths in nursing homes and in other congregate settings of all 296 fatalities to date?
Yes, I do have that data here on my page. We, have been impacted broadly by this. Even just among the 17 unfortunate deaths that we had today, 15 people lived in congregate living settings. And regarding overall deaths among nursing homes, I will be able to share that by the time we have the call afterwards, Nancy, so that I have that data correctly for you. But I do want to take the opportunity to acknowledge how tough it is. The number of unfortunate fatalities we have, each person matters, each family is impacted. And for those who are in nursing homes or congregate settings, they actually have 2 families. They have their own blood relatives, and they have the family of the people in the nursing home or the congregate setting who dedicate their careers to taking care of them. So we recognize that there are a bunch of people who are hurting. If you can just imagine the family of the staff in nursing homes, they are continually facing the fact that we are discussing this every day. So, as all Rhode Islanders keep these people in our thoughts and in our prayers, and as the media appropriately inquires, so we have the numbers in place. Let's remember what our nursing home staff and administrators are going through as well as a family caring for those who have passed away, while we all do what we can to help decrease that from happening. So I'll have those numbers updated for right after, but just wanted to share that. Thank you.
Thank you, Doctor. See you tomorrow at 1.
Yeah, I'll be here.